And so this would be what we call the objective or physical exam portion of being treated. And so every patient, we would have them stand on their toes and stand on their heels, and then do a tandem gait walk, which is a heel-toe kind of walk for balance. And then the patient I'd have stand normal. And so from a general physical exam, I'd look in someone's mouth. Let me see inside your mouth. We're looking for any abnormalities in the mouth. We check the chest area for any kind of abnormality and the belly area for rigidity, softness. We'll also check your pulse, look at any swelling, problems with the skin in your hands and fingers. And that would be a kind of a general exam with a patient. We'd also go through a range of motion if we're talking about the neck, which would be chin down, looking for any restrictions, chin up to the ceiling, right and left rotation, and then a side bending. And so in this, we're looking for any kind of restriction that the patient may have. And then we do what we call palpation. We're going to touch the area, touch the skin. We can feel changes in the soft tissue, tightness, a pain response. Sometimes we'll even feel a triggering response into the tissue in the area that's been injured. We'll do a muscle strength exam, where we'll check the different muscle groups of the upper extremities with wrist extension and wrist flexion. All of this is in accordance to specific nerves, and then arms, and then pull to the ceiling, push to the floor, abduction of arms extended. We ask if there's any sensation, any decrease in sensation in any of the dermatomes, which go to specific nerve groups. We'll do a long track sign as a specific exam, looking for tightness in the spinal cord. We'll do reflexes, which would be looking at the different nerves. Typically I'd have a hammer, but her we can chill easily. So we check reflexes. And we do similar for the lower lumbar area. We have specific exams for shoulders, for knees, for ankles and elbows, which we can go into later. But so typically you'd have a general exam looking at the head, the overall demeanor of a patient, looking in their mouth, their chest, their belly, their pulse, their skin, any kind of swelling. And then we'll focus in on, in this case, we focused on the cervical neck area and the nerves that are affecting or connected to the cervical area by checking muscle strength, sensation, reflexes, and what we call long track signs, which help determine if there's any pathology to the central spinal cord. And that's kind of what you'd expect from a physical exam. From there, we would discuss, again, imaging MRIs, which we would review and connect what we're finding from the subjective, the history of a patient, the facts, the physical exam, and then talking about using an imaging such as X-rays, an MRI, an EMG, which is a nerve study. And then we'll try to devise a treatment plan based on all of that, depending on what we synthesize or bring together.